today I'm going to talk about everything I've gone through with my kidneys. Horrible things, like, oh my gosh. So, back in April, I collapsed at work after a few months of needing to pee really urgently and having a lot of pain in my back, which I just thought was back pain from standing up. And then one day I collapsed at work, wet myself, how embarrassing. And then ambulance was called. I was taken to hospital thinking, oh, it's nothing, I've just wet myself, I'm pathetic, blah, 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 blah. And basically they found that I had a kidney stone on a CT, but they said it was only 4 millimeters. That's like that. Like, if I do it with my fingers, you can see. It's like that. And 4 millimeters is still quite big. You gotta think it's gotta pass through all your things. They just said drink 3 to 4 litres of water a day, take painkillers until it goes away. And I never knew of it coming out. They always said, oh, you'll know when it comes out, like you'll really feel it. And basically, I started feeling a bit better and I thought, wow, clearly it's gone. I still had a little bit of pain in my back, but I wasn't sweating and vomiting and wetting myself. A few months ago, the whole needing the toilet so urgently came back. And then one day at work, I just started getting really sick. I was sweating, being sick, couldn't stand, couldn't walk. And eventually I needed to go back to a doctor. Obviously it needs to be quite urgent to go to A&E, otherwise they just send you back home. Went to my doctor and, what was it? I told them, and I went to my doctor before actually, and basically he was like, I don't think it's going to be the kidney stones, and they basically gave me medicine for a completely different issue, and they didn't help me with it. So a few months later I got even more sick, went back to the doctors, they didn't help me again. So this time I decided to change my doctor to the other doctor's surgery, and they took it a lot more seriously and were actually listening to what I was saying, because I've got Hashimoto's disease, and when you get any illnesses on top of that, it's pretty extreme. You've got to deal with 2 things at once. I also have underactive thyroid and migraines, so often these all come and affect me all at once. Obviously Hashimoto's and underactive thyroid is an ongoing thing every single day of my life. Oh my gosh, I'm so out of breath. And basically, I got a doctor from a new surgery I think it was a month ago or a couple of months ago, to give me a slip or something so I could go for a CT in Brighton. That whole week we were calling the CT department, the hospitals, and they just weren't picking up the phone, which was quite unprofessional because I was in so much pain. I couldn't go to work. I've missed so much work and it's all depressing. And so basically after the 5 days were up, because that's how many days it lasts, I got a phone call from one of the receptionists at the doctor's surgery, which was really nice. And she was like, we need to get this sorted. You need to go for your scan. And, I'm going to try my best to help you as much as possible. So we both decided to call the CT department. Still didn't get through. Eventually my partner got through and they said that they wouldn't accept the piece of paper we were given. It needed to be faxed to us, to them by us, or by the doctor actually, not by us. So we said this, the doctor said that it's normal to bring in a slip and they don't fax it over. So we got another doctor's appointment and explained the whole situation, explained how it's getting worse, and just leaving it and not doing anything is not helping. Obviously I'm drinking loads and loads of water, and basically we went to a new doctor and she did the phone call and sent over the papers to get a CT, and the soonest one we could get was in a town that was quite far away. So that was on Friday, a few days ago, and we drove up to that hospital. We got there 30 minutes early and everything was going fine, but they forgot us. They didn't ask us to come in for the scan. So we had to go up and be like, we've been waiting here, why have you not scanned us? And they were like, oh, reception here didn't send it through to us, so we didn't know. So I'm laying on the bed, ready to get my scan, and she's like, oh wait, I need you to do a pee sample because we need to make sure you're not pregnant. And I was like, oh, I've not been able to pee all day. So she's like, well, I'm afraid you just got to sit down, drink water and pee. and I drank a litre of water, and it was really hurting my insides, my kidneys, my back. I was crying so much, and I felt like there was nothing I could do. And they're just saying, you gotta pee, otherwise you can't see you. And I was in so much pain, they eventually said, look, I don't think the CD department is for you. You need to go to A&E. You need to go to A&E. They could take a blood sample, so you don't need to pee. And then they'll get you straight into the CT. So, because I was in so much pain, I was just like, anything. I will do anything. So, I got taken up to A&E. And then they said that they hadn't received anything from the CD department, so I had to sign in as a new A&E patient. So it would take longer to get seen. And eventually, after like half an hour to an hour of waiting in the A&E in pain, I went into the triage section, and he's looking at me. Obviously doesn't know anything about what's wrong with me, so I've got to just explain it all again. And he's looking at me like, oh, how do you know it's kidney stones? I'm like, because I've had kidney stones before, been sent down for a CT, couldn't pee, blah, 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 blah. And he was like, well, you just need to pee then. And I was like, but I'm here because I can't pee, and they said I need to get a blood test. He's like, no, we're not going to do that, you need to pee. So after finishing the other litre of water, I was in so much pain, and I managed to get out like a tiny bit, and it was all like gross. It was foamy, it smelt gross, it hurt so much. I was literally crying when I was trying to get that out. And then after about 45 minutes to another hour, we're called in to the consultation room with a doctor who's just kind of like sitting back on her chair like this, and she's got her legs wide open, and she's like, so, what's wrong with you? And I'm like, well, has no one told you, like, what everything that's happened? Keep in mind, I was feeling absolutely terrible. They're expecting me to, like, be up there going like, oh, yes, I know everything, like, blah, 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 blah. We just kind of explained everything we knew about my illness, about adrenal glands, about the kidney problems in the past. And she was like, well, I didn't see anything wrong with your pee sample. There's a lot of protein, but we didn't find any blood, so we're not going to scan you. And at that point, I'm like, oh my God, what? I'm only here for a scan. Like, that's why I'm here. She then does say we can go back down to the CT department. Wait, no. At this point, I was like, but am I pregnant? And she was like, what? I was like, well, the reason we came up here was to get a pee sample or a blood sample to see if I was pregnant so I could get my CT. And she's like, oh, we didn't test that. It's okay, you could just pee again. At that point, I'm like, no, because between the time of waiting for that 45 minutes to an hour, I actually did manage to go to the toilet, and it was so much, and it was very painful, and I even said to my partner, I said, I really hope they don't ask for another pee sample, because I think that's my lot for the day. And she's just like, well, you're just going to need to do another pee sample, and I'm like, what? So at this point, we've nearly been here for 2 hours, given a pee sample, and they're just basically saying they don't know why I think I've got anything wrong with my kidneys, even though I've got a referral and everything. So she just said, well, you've got to wait. So we literally sit there for ages and ages and wait. And I managed to get it out again, but it looked completely different this time. Instead of being like clear and foamy and smelly, it was just like, it looked more normal, but with like little bits in it. And keep in mind, we didn't even have urinary cups. They gave us drinking cups to pee in, which I thought was pretty gross. And basically, like, at that point as well, she wants to take some blood. And I'm like, finally, they're taking the blood. They can see if I've got something wrong with my kidneys or anything like that. And, you know, this whole day I was just like, okay, I'm actually bulimophobic. I'm so scared of needles. Like, it sounds stupid, but I'm obscenely scared of needles. I'm scared of veins. Like, that freaks me out. And I'm scared of needles penetrating veins. Anyway, I'm going off point. So she says she needs a blood sample. At this, I'm freaking out a little bit, but I understood that I needed to get a blood sample to see if I was had any kidney problems or whatever. And she then tells me that she's putting a cannula in. Now, I don't know how other bulimophobic or people who are scared of needles deal with this, but I am way more scared of a cannula because it stays in my arm. And at this point, I just started sweating horrendously. I went really pale in the face. I felt very faint, and I started crying hysterically. After that, I can't really remember what happened. My partner had taken me outside to get some fresh air, and I felt very cold because I was covered in tears. And then basically we come in and we were put into something called a quiet room because it was very humiliating being in front of all the people in A&E with crying and everything, and they were just staring. And let me think. So we come back in after the cannula, and then we're in the quiet room, and they say that we got to wait for a doctor to come and see us about the blood test results. And they're saying it's not all bad. Wait, not only that, I totally forgot another section where, like, when we talked to the woman in the consultation room the second time, before we were in the quiet room, they told us you've got bad news and even worse news. And the bad news is that they can't see anything wrong with my kidneys in the urine sample. And the worst news is that they can't put me over for a CT. And that they're going to basically refuse to do so. And then when we're waiting in the quiet room, the lady comes over and tells us that she's about to finish her shift, so she's going to swap it over to another person. I needed to do another pee sample, and I managed to get like a tiny bit out. And she seems ecstatic at that. She was like, yes, I'm so happy, blah, 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 blah. And, yeah. So, at this point, she's basically telling me why I shouldn't get a CT, which I don't think was very professional. She also admitted to me that she didn't know anything about my disease, Hashimotoes, or anything like that, but she was still doing a judgment call on everything else without that knowledge involved, or the fact that I'd been to hospital prior for kidney problems. And basically, she goes home, says that they found even less wrong with my pee when it was the last time I did it. Another doctor comes out to tell me my blood test results and said, oh, it's okay, you don't have kidney disease, or you know, you don't have kidney infection, so you can go home. And I'm sitting there, we've been there for 6 to 8 hours, like, what? I had to deal with my biggest fear, and you're not even going to scan me when I've been to 3 doctors trying to get this scan for the last month. So, then gross things happened. Maybe I'll let you tell the gross thing, because it'll grim me out too much.
It'll grim me out too.
Here, you...
Who are we talking to?
It's just a YouTube video.
Okay, well, YouTube, basically, the doctor ended up pulling the cannula out, along with about an inch's worth of vein, which looked super fun. And it pinged back in straight after. Yay.
I think the issue with that is that he forgot to release the pressure on the cannula and just pulled it out before he took out the cannula, because that's what I was really freaked out about, was I just wanted it off. I was like, fine, if I'm going home, just take this out of me. And yeah, he was like, I couldn't find a nurse, so I'm just going to do it myself. And I think, okay, well, a doctor should know what he's doing.
Wrong.
And it hurt so much. I was saying, ow, ow, ow. And when I looked down to see why it hurt so much, I could see this pink thing and loads of blood. And I looked up at him with like a look like, what? And he just kind of looks at me with a panicked look and then looks down and he goes, oh, it's fine. And he grabs a giant roll of tissue and like holds it down. And then he's trying to get the tape while holding it down. So I hold it down for him, which he did have the cotton bud and everything. So I don't know why he just taped loads of tissue to my arm.
Cover up.
But that was it. And it still hurts and it's been a few days. And it cringes me out because I have a big fear of my veins.
And needles.
And needles. So far, back to square one. I'm still in pain. Haven't got a CT. And they treated me like shit. Like, I didn't even go into the depth on how they were talking to me, like it was in my head, about how they thought that Hashimotoes wasn't that important, or any of these things could be connected. How we tried to talk about the adrenal glands, which cease to function on when you've got Hashimoto's disease, which are directly related next to the kidneys. So it could be any of those things, but yet they just don't care. Like, I don't know if you think I look well in this video. I do not look well. This is not what I look like.
So, even though she was clearly in pain, the doctors felt well enough to discharge her from A&E and send her home.
Without any pain.
Without any medication, without any antibiotics, without a solution.
Also understanding that it had already been 3 days on codeine, so it's not like I could keep taking that. Hope you guys enjoyed my little whatever to talk about my shit in hospital. If anybody else has had any problems in hospital where they don't believe them, especially with Hashimoto's disease.
And by the way, it's Christmas Eve and we're going back to the doctors.
Yeah, I just don't want to go back to the hospital. No more cannulas.
No more.